could be the maximum owner. I want to try and keep moving because we do have quite a few questions from the audience, and we are going to try and stop at 9:15, so we're going to try and keep moving. Our next panelist is Robert H. White, representing Kentucky Association of Life Underwriters. Bob has worked with Old Northwest Agents, a nationwide marketing organization engaged in the sales and service of brokerage-related employee benefit plans for 11 years. Bob established a Lexington office for ONA in 1986, has been an active member of the Kentucky Association of Life Underwriters and the Kentucky Association of Health Insurance Agents for many years. Bob is a past KALU president and the president-elect of the Lexington Association of Life Underwriters. A graduate of Westminster College in Fulton, Missouri, also serves on the advisory committee for insurance reform for the Kentucky Health Policy Board. One of those guys. And my first question to Bob is it appears you were involved with one of the advisory committees for the state. How effective do you think you were, and was your input appreciated?
That's a good question. Can everybody hear me, or do I have to bend down too? Is that okay? Yes. Okay, I'll bend a little. I'll switch it up. I volunteered for that position, hoping that I could knock some sense into some of the people who were putting together the reform plans. I want to backtrack just briefly, and I don't want to take a lot of time for my answer, but we have that 800 number, by the way, that we'll give out here in a minute that the doctor was talking about, that you all will be able to call and get your questions answered by the state. John will give you that number here in just a minute. He alluded to something that there could be an impression that there hasn't been a debate statewide, and I can just see the state coming back and saying, "Oh no, we did have a debate. We had town meetings scattered across the state back in '91, '92, something like that." And I went to those meetings, and then I read the report, and then I looked at the bill that came out. And I just want to say, the meeting results, when you read the report, the bill had maybe 10% of the meeting content of what people wanted in a healthcare reform bill. The rest of it was some other agenda. The committee that I volunteered for was on insurance reforms because I had some background knowing how insurance reform should work, and I've always believed in trying to implement insurance reforms of guaranteed access to coverage, portability, renewability, pricing reforms, all those sorts of complicated, dry subject things. And before we met, the committee on the standard plans met, and I was really curious to see what they did. So I attended some of those meetings. Of course, they were constrained by the law, which said you can have no more than 5 plans. And I watched them work and discuss, and they had a great deal of interplay trying to come up with a plan design of what benefits will be where and what kind of plan design we'll have. The law said you had to at least have a plan equal to Kentucky Care, which is the standard plan. The law says there must be that plan, and that plan at least. And then they changed it where you could have no more than 4 plans. So you have the standard plan plus 3 more. And I don't know, let me just say that there's a budget plan, an economy plan, the standard plan, and an enhanced plan. Each of those have a couple of different levels of cost sharing, out-of-pocket amounts, etc. So there is a variety of plans to look at there, although somewhat limited compared to what you can buy in the market today and what probably many of you have for your own benefit. And the whole time that they were meeting, they were guided more or less by these consultants who were there that the Health Policy Board had hired. And it just seemed to me that they would listen to what everyone was saying, but they would guide everything along. The consultants had the idea, they molded the discussion. There was some input from those committee meetings, but there was still this agenda that they were having to follow based on the constraints of the law. Regarding our insurance reform committee, we met twice. And I was kind of excited when we first were going to go meet. I thought, well, gee, this is great. Let's do something. And it had been a month or more after the other people had been meeting. So we were kind of put on the back burner. Then we went to the meeting. They handed us out some definitions out of the law. And basically they were saying, well, what do you think about that? Well, that's what the law says. And that's what, anybody have any questions about that? Okay, no, let's go on to the next item. There was really no interplay. The law said these are the insurance reforms. We were not able to advise them on anything. And it just leads me to believe, as I look back with 20/20 hindsight, and after hearing what Kent Brown had to say, this whole thing's been orchestrated by someone else. And we didn't have that chance to have the debate with the state that the doctor was talking about that did occur with the Clinton plan nationally, and we need to have that debate.
Thank you, Bob. That's very interesting information. And just reading through some of the questions from the audience, a lot of the questions are pertaining to why all of these things are going on, and there's not any real specific reporting in the media. And that's a good question that we'll hope to address towards the end of our meeting. Our next panelist is Mr. John Keebler. John has worked as a group representative with Humana Healthcare Plans for 10 years. A Lexington, Kentucky resident, John has been extremely active in the Kentucky Association of Health Underwriters for almost a decade. John, a lifetime chair of the KAHU Legislative Committee, is president-elect of the state association. And John has a unique perspective of being inside one of the large insurers in Kentucky, and we're glad you're here. House Bill 250 will impact the way insurance providers do business in the state of Kentucky. What specific changes do you see with regards to this new legislation?
One of the concerns we have with some of the changes is, of course, the opportunity of having choice. When they approach a company like ours, many of the other large carriers, they like to try to provide some sort of healthcare reform on the basis of offering choice, multiple options. And as we see these options rolling out, we've heard about the managed care plans and how the predominant offerings are managed care plans. But if you look at the way the state flows, we've talked a lot about the border counties, but a much bigger issue we addressed in Ashland a couple of days ago, and that is this. A large amount of the state population falls in rural western Kentucky, southeastern, and eastern Kentucky. The benefits that have been proposed are mostly physician-directed benefits